there's just so much.
You're listening to a Mamma Mia podcast.
Hello, and welcome to Well, the podcast for your health and body explained. I'm Dr. Ginni Mansberg. I am a GP. I'm also an unleasher, which is how I know.
Me, Cath Mahoney. I am a hypochondriac, a comedian, and I'm on Unleashed with this lovely lady. But today, this is what we're going to be discussing. Varicose veins. Those pesky, twisted, swollen blood vessels that bulge just beneath the skin. Adult pimples in your 30s and 40s and how to get rid of them. And in asking for a friend, your anonymous awkward health questions, early periods and loud tummies.
But first, it's time for What the Health? Your quick dose of women's health headlines.
What the?
Oh, what the?
This is I don't understand.
What the health?
Okay, I'm ready. Let's roll.
Okay, Cath, people are bleaching their skin and ending up with major issues.
Okay, where are we bleaching and what's the issue?
Well, we're doing our faces. We're
Okay.
doing our necks. I think some people I know are also doing their anuses.
Okay.
Let's be honest.
Okay, not me, not this week.
No. I actually was going to ask you, have you ever
Have I
bleached your anus?
No, I haven't. I've talked about it.
Yeah.
But no, nobody.
Been close.
Don't been close.
Okay, shall I convince you not to do it?
Please do.
That
please
would
do.
be me, and there's a big campaign worldwide to get this thing to actually stop.
Okay.
So it turns out that all the bleaching creams, a lot of which you get online, are full of yucky things that do really bad stuff to your skin. So mercury, which you can absorb through your skin, can damage your nerves. I think that's not such a great idea. Hydroquinone, which in low dose is kind of the gold standard for treating pigmentation, but often these bleaching creams from overseas have got really high dose hydroquinone, super irritating. Like in some studies, up to 70% of people get irritation. Can cause rebound pigmentation when you stop. It can cause this slate grey pigmentation as well. Like it's called ochronosis. It just makes your skin not look brown, grey. It's actually terrible. Potent steroids are in a lot of these bleaching creams that can thin your skin, cause those little red blood vessels, those little
Yes.
broken capillaries, more of those. And I just wanted to say that none of that would be good on your anus. Cath, do you agree?
Okay, making a note to not put anything on my anus.
Yes, if you have some pigmentation anywhere,
Yeah.
let's go and get some really good advice from a doctor or an esthetician, someone who knows what they're talking about, and maybe you do it properly instead of just going for the nearest bleaching cream.
Okay, Dr. Ginni, I'm hearing that knitting can help you kick harmful habits.
Yeah.
Is this true? And should I be getting my purl one, drop one, stitch one on?
I think there have been one or two studies maybe that have linked it to sort of being a little bit like EMDR.
What's EMDR?
It's eye movement desensitization and reprocessing.
Oh, okay.
It's like this whole movement, where you actually, these psychologists do it. I've never had it and I've never seen it done, but it's where they get you to they give you activities that make your eyes move in a particular way, that make you less prone to having nightmares, flashbacks, things like that.
Oh, I've had a bit of this therapy done.
Have you?
Yes.
And it didn't induce anything in you? Because some people feel a lot worse afterwards.
No, it's to kind of clear a bit of sort of trauma or a bit of sort of dark stuff, and you have to follow fingers and eyes, and it's quite uncomfortable, but it was fine.
Yeah, because
Okay.
some people
Maybe
don't
I should
sleep
knit
afterwards.
next
Yes,
time.
I think the knitting, it's a bit of productivity as well. Do you know anyone who could use a pair of socks, maybe a baby
I think
blanket?
I would just be doing a scarf that would get sort of smaller and fatter is how I used to knit.
Yes. There are some people who do believe that repetitive movements, any repetitive movement, is sort of good to activate your parasympathetic nervous system. And so that could help you sort of unwind if you're feeling a bit anxious. I think if you're looking for some medical evidence that knitting is up there with therapy, don't hold your breath.
Okay.
I think you're better off doing your therapy. I think you're better off doing your exercise, you're sleeping well, you're eating well. If you've been prescribed a medication, maybe that's the way to go. I think knitting would be very much a second order choice.
A hobby and a craft.
Yes, but if you like a nice matinee jacket, if you're thinking that could be good, maybe we kill two birds with one stone.
Oh, I like that matinee jacket.
Yes.
Nice. All right, Ginny, I feel like I already know what you're going to say about this one. TikTok is telling us to put cloves of garlic up our nostrils to clear sinus congestion.
What could possibly go wrong?
I mean, is this a new nose spray? Is this actually helping us recover from a cold? And I have to say, I can't unsee some of this stuff I had to watch on TikTok with the cloves of garlic, because when people whap the cloves of garlic out their nose, half of their brain and mucus seem to come out with the cloves. So I don't know. Is it a thing? I think I'm going to stick with a nose spray.
Yeah, I mean, in theory, I can kind of see that garlic has got a little bit of antibacterial benefit. I also think that if you are really contagious, people will see you coming with your garlic stuck out your nostrils and avoid you. So could be a public health service right there. I feel like there's some benefits. And who wouldn't like to inhale deeply on the lovely scent of garlic? And if you can't smell anything, perhaps that's the only thing you can smell, make you feel alive again. So I'm seeing some benefits, particularly on a public health basis. No, I can't see it being too medically beneficial, but what do you think?
Well,
Would you give it a shot?
I have trauma still from when I was 4 and I got an acorn stuck up my nose.
You did?
So I don't like to put anything that's not attached to a spray. An acorn.
Wow, well done.
I got it up there. It took a long time. Mum had to use butter. It was very stressful. Anyway, so I'm saying no to cloves of garlic.
Okay, well, that's good. You heard it first from Professor Mahoney.
Up next, we're going to talk about varicose veins.
How are you? Well, how are you feeling?
Are you well?
Moving on now, Cath, to are you well? If you've ever looked down at your legs and noticed thick, twisted blue veins that seem to have appeared out of nowhere, you are not alone. Today, we are talking about varicose veins, those swollen, twisted blood vessels that bulge just beneath the skin, usually in your feet, your ankles and your legs. Cath, I've spent a lot of time looking at your legs over the past year. She's got incredible legs. There's definitely not a hint of a varicose vein. You don't even have a spider vein there.
Well, no, but I was going to ask you, I have poor circulation, so sometimes I think they're veins, but I think it's just poor circulation. So what really is a varicose vein? Like, can you feel it?
Sometimes. So what you've got to remember is that at any given time, 50% of your blood volume is in your lungs picking up oxygen. That's incredible, isn't it? Because they're so tiny.
Not that big. Yeah.
And then the other 50% is around your body. But in some of us, 1.5, maybe more meters below our hearts, we've got blood down in our feet, in our ankles, and that is pumped back up. Like, it's quite amazing that it gets up.
Yeah.
And so your veins have these one-way valves that allow blood to go back up towards the heart, but don't allow them to go back down, the blood to pool back down, because it's fighting against gravity, right, all the time. And both of us are crossing our legs. Tut, tut, tut. Poor veins having to work against that.
And crossing.
Yes. So sometimes it all goes pear-shaped, and those poor little valves that are meant to help the blood just go one way but not the other just get overwhelmed and go a bit bockety. And so now blood is pooling inside the veins, and on top of that, the structures, the tissues that help reinforce those veins, they're just not as strong as they should be. And then your veins just start to get bigger and bigger and bigger to cope with the volume of blood that they're having to deal with. And then they start to look thick and twisted and blue, and that can be quite uncomfortable. Some people find them really, really uncomfortable as well. And so for some people, they can just feel them. For some people, they look really blue, like if they're quite superficial, because it does depend on which vein has become varicose. Sometimes we need an ultrasound just to see how deep this all goes and how bad it is. And, for some people it doesn't worry them, but for some it's really awful. So your symptoms can include like aching in the legs, even just feeling heavy in the legs, tired, itching. Because sometimes when the blood leaks out, it actually can get really itchy. They can look red. Can just feel like a bit of mild discomfort, especially after like you've been standing for a long time. Like if you've got a job where you could be on your feet, it gets much worse.
Is it age related? Is it something we would get more as we age, or can it happen to anyone?
Well, pregnancy is a big one that tips a lot of women over the edge because, of course, now on top of the one-way valves not working, on top of the tissues around the veins not working.
You're making a person.
You're making a person. There's just a lot compressing those poor veins who are just trying to get their blood back up to their heart for reprocessing and being sent off to the lungs to pick up some oxygen. So pregnancy is a big one. Any pelvic tumours, for example, that'll make it a lot worse. But for a lot of people, it's just genetic. A lot of people, it's just if your mum has varicose veins or your dad. It's more common in men than we talk about.
Is it? Okay.
Yeah.
Shoe type, can that have any effect if you're a high heel wearer?
No, I haven't heard of that being a really big issue. I think it's more about how well your veins can do their job. And so if you do have them, you should go and see your GP.
I was going to say, at what point do you go, it's time to go and see Dr. Ginni or your GP?
So because that blood is pooling, you might be, depending on the type of vein, more likely to get like a blood clot as well. So I think it is definitely worth going and having a chat to your GP and seeing whether you are the sort of person who we can sit on this for a little while or whether, no, we really need to go and get this treated now. And there's so many treatments. Like I feel like when I was in my 20s and like going through medical school, pretty much the major operation that stripped the damaged veins out was major surgery. You needed to wear compression stockings forever. That was all we had. And these days we've got so many different treatments. You will talk about that with your GP. Can I just say that these things are more common in women who are overweight and men who are overweight? And we don't talk about that enough, but we do really need to get you into a healthy weight range just to give those veins a little bit of support so that they don't have to be pushing so hard against a whole lot of extra body weight as well as everything else. Apart from losing weight, just things like stopping smoking is going to really help a lot. And you can get a bit of temporary relief by those compression stockings. You've probably seen them. Yep. They're in my Instagram feed all the time, which I think must mean that it has recognised me as an old lady. But they actually are quite good. So
they can help.
Yeah, so sometimes the over-the-counter ones from the pharmacy are good. Sometimes you've got to have them fitted properly. Like if your veins are a bit worse, maybe go and get them fitted properly and your GP can give you a referral.
Okay.
I think you need to think about your varicose veins as being like a sign that the plumbing isn't working just efficiently as it could be. But if you're looking after your weight, if you're keeping your calf muscles active, let's do some calf exercises now, and see your GP if you're symptomatic. That's really all we need to say.
Beautiful. Okay, up next, adult acne. At what age does pimple popping become a concern?
Okay, Cath, we are going to move on to our next Are You Well? We're talking about zits, pimples in your 30s, your 40s now.
And your 50s.
Yes.
2 hands up, sadly.
I know. It's so crazy. A lot of women feel like when you're that age, you shouldn't be looking like a teenager. You should not be having those zits anymore. But they're actually more common than a lot of women think. So the chances are, if you were born with a uterus, there's at least some hormonal influence on your acne. Studies show that up to 78% of women get an acne flare before their period. So we know it is hormonal for women. Before the age of 25, the really severe acne is all on the boys and the men. Like it's very rare to have one of those severe pizza faces in women. And it's like after the age of 25, men don't get acne anymore and it's all women, and some women are getting it for the first time in their 20s, and the culprit is you hormones. We are looking squarely at you.
Always the hormones.
It is. Bloody annoying. So the key that your acne is hormonal is it stops being T-zone.
Okay.
It's all about the lower third of your face, like the jaw, the chin, even your neck sometimes. And women often get it on their back and their chest as well. That is hormonal acne. Like I can't even tell you. That is your giveaway.
So is that nothing to do with food and what you're drinking, or is it all hormones, or is it a mix?
So the hormones put the ball in front of the post. What you do then can actually kick the ball through the post. So we're talking about things like, look, in some studies, dairy can actually be like quite a big promoter of acne. In other studies, it's not so much. But I think just generally a bad diet definitely makes all acne worse, whether you're that young 18-year-old guy or whether you're the 30-year-old getting your horrible, jawline, big whoppers just before your period. That is just really, really common. But your diet is going to be really important. Getting enough sleep is important. Having enough to drink, managing your stress, any stress that increases your cortisol. Cortisol is very much linked to acne. Hands up who gets acne when they get stressed.
Yeah.
I mean, because I've got that PMOS, I have had the worst acne. Now I'm 58 and it's just getting under control, like just now. But I've had it the whole time. Big whoppers, and stress is like, if I get stressed, it is coming out like I can't tell you.
See, I spent my sort of teenage years with eczema, growing up in the UK, so I had dry skin, never had issues with my skin, would always have the just before my period.
Yeah.
But now in perimenopause, it's like whack-a-mole on my face. So that is just hormones.
It is. It's really hormonal. It doesn't change necessarily how we treat it. What is actually going to change it more is being of that perimenopausal age, our skin is so much more sensitive. So if you take like an 18-year-old, you can throw anything at an 18-year-old skin. Like mostly they can take benzoyl peroxide. You can do reasonably harsh kind of cleansers, those foaming cleansers. Often by the time you get to our age, that stuff is like a killer. Like you actually cannot use the real harsh actives. So that's where we still want a vitamin A, but instead of using like your retinoic acid, we might use a retinol instead because it's just much gentler. We're going to use the niacinamide, which is going to both repair your skin barrier and help reduce your oil, help reduce that inflammation inside your skin. We're still going to want a hydroxy acid, but instead of like a really harsh glycolic acid, we'll probably switch to like a polyhydroxy acid, something like a gluconolactone or lactobionic acid. Any of our skincare enthusiasts, our skintellectual listeners are going to be all over this stuff. But these are the things we're going to want to do now that are a little bit different if you're in your 40s. For the girls in their 30s and 20s, you can treat it exactly the same as you did in your teens, but I would go and get the hormonal test done with your GP because we don't want to miss that.
So are there things that your GP can help you with when it comes to this? So it's not just sitting at home feeling awful, because when it's on your face, it really affects your confidence.
It so does. And it always did. But now we're on Teams and Zoom and stuff like that. It's so bad. And you're on FaceTime with your besties in a group chat. I would say that we do have so many different treatments, but we need the diagnosis first.
Okay.
And so if you do have that PMOS and your skin is a bit of a giveaway, so is irregular periods, maybe some nipple hair, maybe some hair on your snail trail, hair on your chin, and like that's normal in perimenopause. Yes, you do have chin hairs when you're in perimenopause. We don't need to discuss that. But
you can see it.
You can. And you can see perimenopausal women in the mirror in the car plucking every time they get to a light. But if it's starting to go like on the underside of your jaw, going down your neck, that's very suggestive of some hormonal stuff. We can do some tests for things like your insulin level. We can see whether you're ovulating. We can even measure your androgens, your male hormones, polymetabolic ovarian syndrome, so that PMOS that used to be called PCOS. That's the one that I'm really concerned about. The diet really matters. You've got to be low in your carbs. You've got to have enough protein, enough fibre. You've definitely got to be doing some exercise. You've got to get your stress under control. And there, in some instances, we can use a medication as well. It can be really good for girls with PCOS or PMOS.
Things not to do, because I feel like I still do these things. Sometimes I put toothpaste and or aftershave on a spot. Is that really bad?
So they're just going to be irritating. And so what your risk is with that is that you're going to disrupt your skin barrier. Your body is actually going to respond with a lot of redness and irritation, more inflammatory cells to that area. So it's actually going to get redder and look worse before it gets better. But you also risk post-inflammatory hyperpigmentation, so a brown spot, like a dark spot, staying around forever. They are particularly likely after putting a bit of toothpaste or picking at a pimple to actually get a post-inflammatory
we haven't talked
spot.
about picking, so don't pick.
Look, it's just a disaster. Like apart from the fact that it's going to scar and leave a little indent that is really expensive to fix. Like we're talking either you're going to put filler in it, which is really expensive, or you can try and laser it. Either way, you're in the thousands, right? So please don't pick. But for people with skin of colour, they can actually get those dark spots that look like a scar. They often are in a scar, so they've got the depression and a whole lot of discoloration that can never, ever go away. So the picking is not good, but getting your acne is under control, because all acne can cause those scars and all acne can cause those pigmentation spots. We just got to get on top of it.
Up next, asking for a friend. We're talking unpredictable periods and stomach noises. God, I love this part.
Me too.
I'm just asking for a friend.
So, my friends, they want to know.
It's not for me.
Hashtag just asking for a friend.
Okay, it's time for asking for a friend.
Woohoo!
I know it's really not a question for your friend. It's for you. That's fine. I won't say anything. I'm often that friend. Okay, today's question comes from Stacey.
Hi, Dr. Ginni and Cath. My friend is 29, and for the last few months, her periods have become really unpredictable. Sometimes they're a week early, sometimes they're late, and they've also started spotting in between. They've never had this happen before. Should they be concerned?
So I've got questions, Stacey, for you to ask your friend. is there any chance she's pregnant? Like, I know that sounds really dumb, but like sometimes if you haven't had a period for ages and then you get a bit of spotting, that can actually be a pregnancy.
Yeah.
So just make sure you're testing for pregnancy. Has she lost a lot of weight? Because eating disorders wreck your periods and it's really, really common and we don't talk about it enough. Our eyes are out with the 15-year-olds and when it comes to our 29-year-old friends, we are just forgetting about it.
Yeah.
So if she's lost a lot of weight, I am a little bit concerned. Has she put on a lot of weight? Because believe it or not, we've talked a lot on this show about PMOS, polyendocrine metabolic ovarian syndrome, which used to be called PCOS or polycystic ovarian syndrome. One of the key symptoms is an irregular cycle. And it comes usually with pimples, it comes with chin hairs, sometimes hair around your nipples, it can come with excess sweating, a lot of anxiety, it can give you a lot of mood disorders. If that is you, sometimes the key is that you put on a heap of weight and all of this happens at the same time. We don't want to miss that because that's a really important condition that can impact your body later on. Everything from diabetes, early onset heart disease, early onset dementia, a few cancers, like we need to get on top of that. So they are all the questions that I'm thinking about. And I think it's a good idea for Stacey, for your friend to be thinking about while she books the appointment with the GP.
Yes.
Because when you're in your teens, we give you 2 years of irregular cycles.
Okay.
A lot of people don't realise that. I see so many girls who are like, she's 13, she's had 9 months of her periods, they're still not regular. Totally fine. You've got 2 years to get that under control. After that, we want them to be regular. But this has come out of the blue for your friend, Stacey. So we definitely, no matter what, we are seeing the doctor. But maybe just get her to do a pregnancy test. Think about the weight situation. Think about whether there's extra pimples. Think about whether there's extra chin hairs or nipple hairs. And then go and book the appointment with the doctor because we've got to get to the bottom of this.
Okay, this one comes from Anonymous. I'm going to read it out. Why does my stomach choose the quietest moments to make the loudest noises? I can be sitting in a meeting or a movie theatre and suddenly it sounds like there's a washing machine inside me. Is this normal? Anonymous, you and I both.
Yeah, I was going to say...
This could be from me.
Correct.
I feel like
Is it
most
from
of the
you?
Anonymouses could be from me. I get so embarrassed about this.
I know, but I can't hear them when you tell me, did you just hear that?
Oh, I feel like forever on the podcast or Unleashed or when I do voiceover stuff, it's like... It's like a little opera in my tummy.
You know,
What's
when it
going
happens
on?
to me, it happens to me when like a patient is pouring their heart out to me
no.
and my stomach's just going crazy and I'm like, shut up. It's not about you
It's
right
not
now.
about you.
Can you just
Oh.
let it be about her?
Is it about food? Like, what is it about?
It's borborygmi is the medical
Who?
term. Borborygmi. Is he another of your waiters? Is he someone you
I
met
feel
in?
like he was in the Muppets.
Borborygmi, he was commenting on the opera. Borborygmi is the medical term for those loud sort of gurgling noises in your tummy. They're normally completely normal, as so many of your symptoms are, Cath, and they're bigger in your head than they are in the true world. They happen basically as your stomach and intestines are squeezing the food through, which you want them to do because otherwise it all stays in your stomach and it never gets spit out as a poo. So we want them to be doing that. And sometimes it happens as your stomach empties out and telling you, hello, ready to eat.
Hungry.
We've just had the last bit of food. It's sat in there for 4 hours. We were extracting all the protein. We were breaking it up using our acids to actually break it up into little bits, ready for the intestine. And now we're ready for you to add a little bit more. That is pretty much mostly what it is. However...
Is there ever a bad time? I feel like you're about to go dun dun dun.
Yes. Okay, so here are the things we need to warn you about that if the borborygmi is part of a package deal, Cath, and the package we've thrown in for free, some severe abdominal pain.
Yes.
Some severe diarrhea that is hanging around. Like it's not just like a one-off where you just go, what the hell is that? And then you move on. It's going on. You are continuing to vomit. You are bloating and it's never going away. If you have had any change in your bowel habit, I think well listeners know I'm like obsessed with changes in the bowel habit. Like you need to go and see your doctor. If you have now lost weight, not because you're trying to, but because you're just going, what the hell happened? I don't really understand, but now I'm like, my clothes don't fit me anymore. You do need to go and see your GP because... just occasionally, when I say occasionally, I don't have a stat on it, but like I'm guessing 1 in 1,000.
Okay.
It could be a bowel condition. And with any of those things, please, we just don't want you to miss it. Better to be the Cath doll hypochondriac and book one extra trip to your poor GP who's just going, you again. No, but seriously, for all of my patients, I would rather that they actually turn up and get everything checked than miss something really, really bad.
Okay. Who is it? Borberini.
Borberini.
Who?
Cath, that is it from us for another week. Can
It's
you
over
believe
too
it?
quickly.
It is. Now, guys, please don't forget to follow the show because that is the way that you never miss an episode. And who would want to miss Cath and I singing the Muppets theme? You would not. If you follow the show, it is going to drop straight into your feed automatically. And if you're feeling generous, and let's face it, if you are listening to this show, you are a generous person. We know that. Mm-hmm. Can you please just take that little 60 seconds extra and drop us a rating? 5 stars, 10 stars would be great, and an excellent review about our singing and perhaps some of the information as well. And can you do that on Apple Podcasts and or Spotify?
And if you want to hear your asking for a friend question, super easy. Send us an email or a voice note.
Yes,
to
love those.
We do love those. To well@mamamia.com, and we, aka Dr. Ginni, will get to the bottom of it. Please remember, information discussed in this podcast is for education purposes only and is not intended to provide professional medical advice. Please seek your own medical advice specific to your circumstances from your healthcare professional. See you next time.
And stay well.
Mamma Mia acknowledges the traditional owners of land and waters that this podcast is recorded on, the Gadigal people of the Eora Nation. We pay our respects to elders past and present.